With the interest in time, we move on to the next presentation. It is from Dr. Rashmi, who would be speaking on onset of chronic diseases across varying birth cohorts, unraveling the health and longevity of Indian adults. So, Rashmi, you can maybe present your screen and yeah, take over.
Yeah, is it audible?
Yes, you're audible.
Yeah, the
If you can
screen
go to
is,
the
yeah.
presentation mode. Yeah, you're in presentation
Yeah,
mode. Please start.
okay.
Thank you.
Okay. Good evening, one and all present here. My name is Rashmi. I am a PhD scholar from International Institute for Population Sciences, Mumbai. Today, I am going to present my work on the topic onset of chronic diseases across varying birth cohorts of Indian adults. So basically, before moving on to understand the concept of development or the onset of chronic diseases, I think it would be better to highlight the roller coaster scenario of the longevity scenario across the globe and the India. So basically, the longevity, which has increases across the globe in the last few decades due to the decreasing mortality and advancement in the medical technologies. These has result into the decrease in the communicable diseases across the globe. And in India, it has been seen that the communicable diseases has significantly decreases from 61% in 1990 to 3% in 2016. However, correspondingly, there was an increase in the years lost due to chronic diseases from 30% in 1990 to 55% in 2016. These scenarios give a broad picture showing that the extended life gained in the longevity was suffered by morbidity during the last few decades. This term has been referred as morbidity expansion. Morbidity expansion is basically the state in which the individuals would live longer but spend these additional years in the worse health. Today, this theory is best fitted in many developing nations like India, where the population aging had fueled the chronic diseases. So, is single morbidity expansion only the threat? The statistics shows that the burden of chronic diseases is increasing in the adult population. According to WHO report, it shows that 15 million deaths among working age adults due to chronic diseases had occurred, and among whom 85% were from the low and middle income countries. Chronic disease burden had occurred in every age group population, which significantly challenges the best fit morbidity theory, which is the single expansion theory across the globe. So this scenario has also been highly evident in India because of its vast demographic and epidemiological shift. So the question arises, is India experiencing a single morbidity expansion where the additional years added in life are suffered by diseases, or are the diseases expanded in early ages too? What is the scenario across different cohorts or the generations? Here comes the need of the study, where we want to understand whether the younger generation is under the chronic disease havoc, and to understand how much time does the Indian adults spend in a chronic condition. These questions can't be answered showing the chronic disease prevalence. However, we need to explore the first age at which the Indian adults are contracting the chronic diseases. This comes to the objective of our study, which has explored that the age at onset of chronic diseases across varying birth cohorts of middle-aged and older adults in India, and their prognostic factors using the competing risk setup. The data used to explore the objective is from LASI data using 65,258 individuals aged 18 plus. We have used kernel density plot, box and whisker plot to explore the age of onset of different chronic diseases across the varying birth cohorts, and further, the competing risk analysis, a form of a multi-state survival model, has been used to understand the prognostic factors contributing towards the onset of these diseases. The kernel density plot and the box fix plot, which explain the onset, will be shown in the results. I would also like to point out here why we are using the competing risk model. Why not the general hazard survival model? So basically, the competing risk analysis here tries to cover when the time to event analysis, sometimes when the other events may preclude the time of occurrence of the primary event of interest. At such events, the competing risk setup is very helpful. For example, in this setup, when we are trying to conquer what is the risk of hypertension, there might be the situation when hypertension may or may not be affected by other diseases like diabetes and all. So using the competing risk setup, we are trying to solely understand the risk of hypertension, keeping in control the risk of the other diseases in the analysis. So further moving on towards the variables which were considered. Here, the outcome variable is the age of onset of 7 medically diagnosed self-reported chronic diseases, namely hypertension, diabetes, lung disease, heart disease or stroke, arthritis, neurological disease, and cancer. The main explanatory variable here is the birth cohort of the individual, which are born before 1951, 1951 to 1960, 1961 to 1970, 1971 and above. The control variables are also considered in the analysis, which are the individual, behavioral, and socio-demographical variables. So moving on to the results of the study, here it shows the scenario of chronic diseases in Indian adults. See, the results highlighted that the age-6 adjusted prevalence of having any chronic disease is around 41.7% across the Indian population. Hypertension is significantly affecting the population with a higher percentage of 26.8%, followed by diabetes, arthritis, lung disease, heart disease and stroke, and neurological diseases. Further, moving on to see whether the age of onset of diseases is more highly precedent towards the younger generation or the older generation. So here it shows that the chronic diseases are expanding in the early ages of the younger generation. The age of onset of the chronic diseases, you can see here the peak here or the concentration of the chronic diseases at the early ages of the younger generation, 1971 to above a birth cohort, and it has precedently decreases throughout when we move towards our back generations. Next, we have shown the box and whisker plot, which shows that nearly half of the population develops chronic diseases nearly at the age of 40 to 50 in the younger cohort. In comparison to those who were born in 1951, the median age at onset of diseases were around 65 to 70. But in the recent generation, in the recent cohort, we see that in the 1961 to 70 birth cohort or the 1970 plus birth cohort, this median age at onset has decreases to 48 to around 40 age. So further seeing the results of the prognostic factors, which has been the factors which are affected the onset of the chronic diseases using the competing risk setup, it shows that significantly the younger cohort have been in the higher risk of having any type of chronic diseases, especially the hypertension and neurological diseases. The risk of developing hypertension, arthritis, and cancer was higher among the females than the males. Further, we have seen that with the increasing level of education, the risk of the hypertension and diabetes has also increased in our population. The working status, in terms of working status, those who were not working, the risk of obtaining a particular disease was also a little bit higher than those who were currently working or have ever worked but not working currently. Significantly, the depression has significantly affected the risk of nearly all kind of chronic diseases, especially the neurological diseases among the middle-aged and older adults of India. Here we can see that those individuals or those adults who were involved in physical activity, in higher physical activity. I should like to mention here that the physical activity here is derived from both the moderate and the vigorous physical activity. So it also includes the vigorous physical activity variable here. So those individuals who were involved in physical activity had a higher risk of developing heart disease or stroke. Further, we see that compared to the poorest 10th quintile households, the hazard risk for hypertension, diabetes, lung disease, heart disease or stroke, and cancer were highest among the adults and elderly in the richest wealth quintile households. Adults in the urban areas were less likely to develop arthritis than their rural counterparts. So, concluding towards the different findings which we have found here and towards the conclusion, the present study highlights that the chronic diseases are emerging earlier among the independent and working age group population. Younger adults are no longer healthier than their predecessors, and lower median age at onset of chronic diseases in the younger cohort shows that the younger adults are spending much more time in the chronic conditions. This highlights towards the fact that not only the single expansion, morbidity expansion, but the India is now on the verge of experiencing the double expansion of chronic of morbidity expansion theory. Further, the education and the working status, depression, physical activity, household wealth quintile, and place of residence emerge as the prominent prognostic factors predicting the onset of chronic diseases in the middle-aged and older adults in India. The early onset of chronic diseases in the independent and the working age population can have many social and economic implications. For instance, it can create a greater healthcare burden when these individuals who are today contracting disease at an early age, when they grow older with these diseases, how much burden it can create on the healthcare system and the overall health system of a country. So the proper interventions and policies are required to tackle such situations in the future. The recommendations are we literally need to reinforce the balance between the physical and the mental life of individuals, as both the hypertension, diabetes, along with the neurological diseases are on the verge of increasing their threat towards the younger generation. Looking at the sedentary lives of the younger generation, and in accordance to the findings of this present study, the programs are required to promote the habitual physical activity across India. More research on adults and the elderly is required to point out the need for health data and the policies towards a healthy and a better nation's future. Thank you.
Thank you so much for Dr. Rashmi. It was very interesting to know about different metabolic disorders and how we don't want to age earlier with a lot more diseases, I think.